Okay, I was supposed to swim and also record because some of you might want to see what you are doing. So, and good. I'll just start with reading like from those on the group. So now I'll read the guidelines again so that I won't be carrying stories later on. So I'll read the guidelines again so that you can please pay attention to this guideline again. Now, your presentation, please, can you hear me?
Yes.
Please.
Yes.
Okay. Your presentation is a 5-minute elevator pitch on your policy proposal. It's simply you trying to sell your policy to your key stakeholders. You'll be graded based on how well your presentations answers this question. What's the problem? Why should your key stakeholders intervene? How can they fix the problem? Now, you can find every information you need in your policy document if you put the required effort when you are drafting it. Now, please take note. You are not giving us a documentary. It's 5 minutes. Like immediately 5 minutes is hitting. You are just going off. Like I'll even mute your mic if you keep on talking. You are not giving us a documentary. Either are you having a school tutorial. Therefore, your slide and speech should be straight to the point. Now, a maximum of 2 group members can present if needed. Like if you want to have, that's the maximum. If you want 2 people to present, but it's 1. So presentation will last for 5 minutes. Now, a PowerPoint presentation, I know most of you have prepared it. Now, 2/3 of members of a group must be present. Now, I had issues with this. Some people were saying that they were the only people that are serious or something like that. Their group members are not responding. Okay, I think we still can go with that. We might not take this 2/3. We might not work with it. Now, let's come in will not be tolerated. Don't come later on and be telling me that you were supposed to present by 9 a.m. and you didn't know. That's like you are telling us stories. It won't even work out. Now, and also only group members available during the presentation will be awarded marks. So I'll be calling your groups now. I don't know if RK is ready. RK, can you hear me? I don't know if but I think this person is here. And Yeshua, can you hear me? Yeshua, can you hear me, please? I don't know if RK can hear me and Yeshua. Please, can you hear me? Please respond.
I can hear you. Good morning.
Good morning. Please get me the link to the form, like the attendance form. Now, this is how it will be. You are not sending attendance like the usual way. What will happen here is that if I group name, you are not in the attendance. You get me? You wait till when you are called upon. That's when you sign attendance. You won't sign attendance haphazardly, like anyhow. So now if I call this first group, now the first group here I'm seeing is SCOPI group 4. That's Sunday Priska. So if you are in that group, you should sign your attendance now, immediately now, so that when you're presenter, when I call upon the group to start, then they can sign it. So it's supposed to be accordingly. So you that are like ahead, please don't sign now until I tell you to sign. That's when you are going to sign. If I didn't tell you to sign, please don't sign. Don't sign in. Please, can you hear me? So the first group now is Sunday Priska, SCOPI 04. They are the one that they are going to sign in now. So after they are through, then the next group will start to sign in. Please, if it's not your turn, don't sign in. Please, I'm begging you. So I don't know if I'll be making, please mute your mic, please, to avoid any distraction. We will want to be very fast today, please. So I'll be making Sunday Priska the co-host now. Please, if you are part of that group, sign in now. Please sign in now. So I'll be making her the co-host so that I'll be giving her 5 minutes to start the presentation. So I don't know if you are ready, Sunday Priska. Can you hear me?
Yes, I can hear you.
Okay, then I've made you the co-host. Your time will start immediately you share your screen.
I'm sorry, the problem is that I don't know how to share my screen. I'm not
Please, whose mic is muted? You see on your Zoom, you see share on your screen. Like in your Zoom, you see share. Just click on share, you see screen. Just scroll down, you see screen. Again, for signing in, please, if it's not your group turn, don't sign in. If it's not your group turn, don't sign in, please. We don't want an issue, any issue. Please don't, if it's not your group turn, don't sign in.
Is my screen being shared now?
We can't see your screen, please. Someone from your group can assist you in sharing the screen if you can't do it.
Okay.
Please, I think we'll just move to the next group before they fix that issue. I want us to be fast about this. So, and Abdullah Karimat, you can, I don't know, Daniel Lawal didn't state the group. Like, who is that?
Good morning. Please, I was trying to share my screen, but it's saying that the host prevented the attendee from sharing screen or something like that.
Okay, you're part of the group, right?
Yes, I am.
Please, okay, I'll make you the co-host, don't worry.
All right.
You can share your screen now. Please, let's be fast about this. Other people are waiting. Please, if you are not ready, the next group can move on, please. We don't want to be wasting time here.
The next group should move on, please. Let's sort that out.
Okay, Abdullah Karimat, if you are ready, please, you can go ahead.
All right. Hi, Joshua. Good morning. Can you permit me to share my screen, please?
Yeah, so and the next group, and Abdullah Karimat, the next group should sign in now, please.
Can you see my screen now, sir?
Yes, no, we can't see your screen.
Oh, please.
Please, if your group is presenting, sign in. If your group is presenting, sign in.
It's not working. I don't know. It's not working here.
Why is it not working? Abdullah Karimat, can you share your screen?
Yes, I can. Just give me a moment.
Sir?
Let me know when you can see my screen.
Yes, we can see your screen.
All right. All right. So can you see this?
Yes, we can see.
All right. One, good morning. I'm presenting on behalf of Skura 6. Let's talk about a brief story. Susan was the eldest daughter in her family. She was intelligent and hardworking, and even though she worked hard at home helping her mother, school was her top priority. She always came first in her class and was the pride and joy of her family and community. She won a scholarship to go to university. She studied diligently and made sure she was always at the top of her class. Her professors were very proud of her and took special interest in her. They encouraged her to pursue her professional dreams. After graduation, she joined a professional firm and sent money home to pay school fees for her younger siblings. She became the breadwinner of her family. She met and fell in love with a colleague at work, Ben. At first, Ben was gentle and loving, but gradually that began to change. He became distant and unkind to her. She soon discovered that he had another girlfriend and told Ben that the relationship was over. Ben became very... He knew that she was... her out the door, he declared, "I know that when you become pregnant, you will return back to me." 3 months later, after falling sick for quite a while, she went to a clinic and was shocked to discover that she was in fact pregnant. She determined that there was no way she would go back to Ben. When she inquired at the clinic about ending the pregnancy, the staff looked at her with disgust and refused to answer her questions. She went to another clinic to ask about terminating the pregnancy, but they also turned her away. She felt afraid and was too ashamed to tell anyone in her family about the rape and pregnancy because she felt that no one would believe or help her, and she became desperate. She tried drinking a toxic portion of household chemicals and that she heard from her friends would terminate a pregnancy. She also tried inserting sticks into her cervix. She became terribly sick and developed a painful infection, but was still pregnant. And eventually, after trying all of
Please, we can't hear you, Karimat. Am I the only one that can't hear Karimat?
No, me too.
I can't hear as well.
You are not signing in now till your group is called upon, please. It's even recorded, so we will know exactly who is presenting at that particular time. I don't know if her network, I don't know what's wrong with her network. Please, we can't hear you, Abdullah Karimat. Please, is anybody in her group that is here, please? Abdullah Karimat, we can't hear you. I don't know who is the next on the line. And Yeshua, who is the next on the group on the line, please? The next group. I think it's okay. Chiku Kingsley. Okay, Chiku Kingsley, please. You can go ahead, please. I don't know what's wrong with her network. Maybe when she comes back. Okay, Chiku Kingsley, can you hear me?
Yes, I can hear you. Okay,
Okay,
so I'll share my screen now.
okay. Please prepare before you present, please. I don't want a situation where I'll be waiting for people to present, please. Okay, Chiku, can you hear me, please? If you are not ready, just let us know so that we can move to the next person that is ready.
I don't think he's been made the co-host.
I've made him the co-host, so he's supposed to be able to. Okay, Chiku Ezeni, I've made him the co-host. I can't even hear him.
Okay, I got logged off, so I logged back in again. Let me share my screen.
Okay, please do it fast.
Okay, they told me that it's only the host. I don't think I've made the co-host yet.
Wow. Oh, sorry. You logged back again. That's the reason. You are the host now.
Okay, thanks. Can you see my screen?
Oh, yes, we can see your screen.
All right. Okay, so my presentation is on the neglected tropical disease under SCOPI 04. So we'll begin right away.
Yeah, you have 5 minutes, and if you are in this group, please sign in now.
Okay, so we'll begin with what the problem is. So as you can see from the slide, the first one is poor management of patients suffering from neglected tropical diseases. So this poor management is as a result of the fact that medical personnel in hospitals and clinics are denied the proper training on how to effectively manage patients with suffering from neglected tropical disease. And the next one is mass ignorance of the causes and prevention of neglected tropical diseases. And this mass ignorance has led to, or is behind the figure which says that about 100 million people in Nigeria are prone to neglected tropical diseases. And this number makes up 25% of Africa's NTDs burden. Now, the next one is the lack of adequate medical facilities for NTD patients. So hospitals and clinics do not have, or not all of them do, but the majority do not have the right facilities within the hospital or clinic premises.
Please, we can't hear, or rather, I can't hear the current presenter, please.
It's your network, please. We can hear him. It's your network.
Okay, I'll continue. So the lack of adequate medical facilities to combat these NTDs is as a result of like the fact that the government, maybe from the government, or a lack of funding, which these hospitals and clinics can use to combat the NTDs. They are owning the right facilities for that. Now, the next one is the lack of adequate funding to tackle NTDs in Nigeria. Now, in the earlier part of 2022, this year, our President Buhari, presented a budget to the House, of which health composed 4.3% of that budget. Now, that 4.3% translates to 711.28 billion out of a budget which was projected to be about 16.39 trillion naira. So you see that the lack of funding stems, the root of the problem stems from the fact that the presidency, the government, isn't budgeting enough to the health sector. Now, the last one is the inadequate training of medical personnel in the management of patients suffering from NTDs. Now, this inadequate training of these medical personnel translates to a limited understanding of the neglected tropical diseases and their deficiencies, and this can lead to can lead to improper management of patients that suffer from NTDs in hospitals and clinics. So moving forward, now the next one is, why should the key stakeholders intervene? The first one says that they are duty bound. For the fact that they are stakeholders in the health sector, they are duty bound to attend to every problem and any problem that concerns the health sector. Now, the next one is neglected tropical disease is an important issue in the matter of health among Nigerians. Yes, so the NTDs happen to be a prevalent topic in health issues that concerns Nigerians, because it's a group of diseases that claim a lot of lives. According to statistics, about 1 billion Africans are exposed to NTDs on a yearly basis. Now, the next one is that NTDs are part of the World Health Organization's 2021 to 2030 goals. Now, in the year 2021, the World Health Organization launched a roadmap for NTDs with the aim of achieving its elimination and prevention by 2030. Now, this roadmap was instituted after the first one, which was brought in I think 2012. Yeah. So, and also it was brought in because the NTDs, which were part of the Sustainable Development Goals, was a failure on that part because the SDGs, it couldn't do well in being part of the Sustainable Development Goals. Yeah. So moving forward, now the next question is, how can they, the key stakeholders in this health sector, solve the problem? Now, I'm starting with the federal and state governments. By investing funds in establishing the right facilities to combat NTDs. Now, starting from the budget, as okay, from what I said.
Please, your time is up. I think we can move to the next group. It's strictly 5 minutes, please. Let's stick to the time. Thank you so much for this presentation. It was awesome. And the only comment I had was just that, and based on what you presented, it was quite neat. You brought out the statistics, but I didn't. It's not like you should state exactly like just answer the question directly in that way. Your slides should the content of your slide should answer those questions. That was what I meant. Doesn't mean that each heading should have why, what, and how, but it's quite good. Thank you so much for this presentation. Please, can you all hear me?
Yes.
Yes.
I can.
Yes.
Yes.
Okay. Okay. I think RK and Yeshua can give the marks already. You can give the marks already. So, and I think Abdullah Karimat is back. Please, you have 3 minutes. You can share your screen now and start, please.
All right, it says only hosts can share in this meeting.
Do it again. I've made you the co-host. Please, you have 3 minutes. Immediately you start, you have 3 minutes, please.
All right. Abortion is termination of a pregnancy by removal or expulsion of the fetus or embryo. And according to the World Health Organization, an abortion is considered safe when it is done by a skilled certified professional appropriate to the pregnancy duration in an environment that is medically safe. Africa has the highest rate of unintended pregnancies in the world at 91 per 1,000 women, and 37% of these women choose to interrupt such pregnancies. Nigeria is the fourth highest country with maternal mortality globally, and the second leading cause of maternal mortality is unsafe abortion due to the legal but restrictive laws centering abortion in Nigeria. Poverty, lack of access to contraception, gender discrimination, early and forced marriage, amongst others. Advancing women's access to safe and legal abortion is a fundamental priority for improving women's sexual and reproductive health. In Nigeria, unsafe abortion causes about 20,000 deaths annually. And apart from the rapid increase in maternal mortality, unsafe abortion can lead to severe medical complications such as sepsis, excessive bleeding, pelvic infections, vesicovaginal fistula, amongst many others. And this further puts a strain on the already marginalized and unequal healthcare service provision, as more resources will be needed for immediate post-abortion care and long-term avoidable health challenges. Lack of accessible contraception methods and high costs leads to a lot of unplanned pregnancies, and due to the restrictive abortion laws, women turn to unsafe methods to terminate their pregnancies. To reduce the rate of maternal mortality in Nigeria and simultaneously work towards achieving the UN SDGs 3 and 5, it is important for key stakeholders such as the government, Ministry of Health, health workers, and medical schools and students to join hands towards increasing access to safe abortion, thereby ultimately lowering the rate of maternal mortality. The government and Ministry of Health can ensure access to safe abortion towards implementing policies that legalize safe abortion. It is important to expand abortion and post-abortion care by providing easily accessible modern abortion care methods and contraceptions at all levels through allocation of more funds to the health sector, especially in terms of sexual and reproductive health, and also to provide adequate training for healthcare professionals at public and private facilities. It is also important to adopt education laws stating that sex education should be included in secondary schools and tertiary institutions' curricula. Medical schools can support this cause by encouraging and supporting medical students in advocacy and also including abortion and post-abortion care in the medical school's curriculum. On the part of health workers, it is important to provide adequate.
Okay, thank you so much, Abdullah Karimar, for the presentation. It was quite nice. So, and the only comment I have concerning the presentation is that the contents are quite, like, I wouldn't say much, but like you are reading a 5-minute presentation and the content should be like straight to the point, like very, very exact, because you don't have so much time. So it's best that you like just make sure that these are the key points that you are stating so that you won't take so much time in presenting your ideas. So that because if you are presenting this fast, some people might have like comprehension issues because the people that I may be talking to might not be so good or vast on this topic and the rest, and you are presenting it in such a fast way, so they may have issues with that. So thank you very much. So I don't know who is the next group.
Good morning, everyone. Good morning, everyone. I hope you can hear me. So, I just want to make this quick comment for other people that will be presenting this morning. A presentation is it's just meant to have like salient points that you shouldn't forget. Not that you read the slide one by one. You can have your statistics on the slide, but I feel it's better to have your points. Okay, medical students should do this, and this should happen as salient points, and you can then choose to elaborate on them.
Okay, thank you so much, Joshua, for that comment. So I don't know who is the next person to go. Please, it's strictly 5 minutes. Please, let's stay. I'll be sending a time like in the chat box so that I can be seeing how many minutes is left so that I can work with that. So I don't know who is next. I think the next person is Okoro Ovi. I think so. I don't know if he's ready. Please, if you know, please, everyone should get ready before your main time. Please, if Okoro is here, please, can you hear me?
Morning, sir.
Okay,
Are
good
you hearing
morning.
me?
Yes, I can hear you. I'll make you the co-host now so that you can start. You have 5 minutes, please.
Okay, let me try and share.
Please, if you are in his group, you can sign in now. If you are in his group, please, you can sign in now. And to be clear, we are following a list, like those that came in earlier gave their names and their groups. So that was what I've been calling so far. So if you will be presenting, if you are the group leader, immediately you join, you can just like write your group name and everything in the chat box so that we can be following that, like following it. If you are the group leader, let me put it that point. So that's what we have been following so far. And please, immediately after your presentation, you are free to go, please, so that you won't like have a lot of people waiting and waiting for, I know till when. You can go, you are free to go. It's not compulsory, but it's best you stay. But if you can't stay, you can go. If you have something more urgent to do, you can go. It's not compulsory. Okoro, you shared your screen and it went off. I don't know what's wrong and I can't hear you anymore.
Can Priscilla help me share this screen?
Okay, Priscilla, if you are there, please help him share the screen. Priscilla, please indicate. I can't see you. Okay, Priscilla, you can share your screen now. Please, if you are not ready, just let us know so that we can move to the next person.
I am Okoro Ovi Precious, and I'm from NiMSA. I will be representing my group in the presentation on our policy universal health coverage. Firstly, I want to know the meaning of universal health coverage. Universal health coverage is when all individuals in population are able to access quality health care without financial constraints. If we look at the country at large, we won't say that is the case. Nigeria has tried. They put out an health insurance about 23 years ago when the population was at 200 million. And from statistics, only 30% of the entire population was to register for that, which led 70% uncovered. This goes to show that UHC is a very serious problem in Nigeria. So what are our key stakeholders? Why do we need them? Our key stakeholders from the policy were the government, the federal and state ministries of health, healthcare officials, hospitals, private organizations, and students. Why is government needed? Because they are the ones who actually have the interests of the nation at heart. The federal and state ministries of health are the ones that can push the government for this change, and the healthcare officials are the ones to implement the change. Private organizations, they do a lot by bringing funds together. So the next thing is, how can these individual stakeholders intervene? If the government make the health sector is part of their budget annually, they put UHC, put health insurance annually into their budget, we are sure to have covered a major problem in funding. The federal and state ministries of health have to put the health sector into policies. QAC should be a primary discussion every time they are about to create a policy. Hospitals and healthcare officials should be ready, constantly ready to assist and implement the policies when they have been passed out. Private organizations should pull in funds. Universities, medical students, the idea is that we should be aware and spread the awareness. So once the awareness is there, at least the problem of ignorance should be solved. If our key stakeholders work together to fulfill their individual roles, we are sure that QHC can be achieved in Nigeria. Thank you very much.
Thank you so much, and Ovi Okoro. This is a very nice presentation. I would like to take comments from Joshua and Arki. Please, Joshua and Rakia, please let's be fast with the comments, please. Very fast.
Well done, Okoro Obi. Well done. Thank you for keeping to time. I very good presentation. I just thought you could have fleshed it up a bit, maybe with statistics. However, I understand the time constraint always consider, but
Okay, thank you so much. I don't know if RK has any comments before we move to the next person. I don't know who is the next here. Let me check. So after OV is Bella Omunagwe Lovett. Yes, Bella. Bella, that's code for 3.
Good morning.
Good morning. I think RK wanted to say something. I don't know.
Okay.
Just go ahead. Just okay.
Okay, the presenter for my group is Olamide Sultan.
Okay. Olamide Sultan, can you indicate please so that I can make it a co-host? Olamide, I've made you the co-host now. Olamide, if you can hear me, you are made the co-host. You can share your screen. Please, let's be fast about it. And also, those from Olamide group, immediately you start sharing your screen, please, you can sign in. Olamide, are you there, please?
Yes, I am. I'm trying to share the screen.
Okay, and Yeshua, don't forget to put the greet, please. Olamide, please. You have 1 minute to share your screen, please.
I'm not getting how to share the screen. That's the problem.
You click share, like on your Zoom, you see share. Just click it and scroll down. You see share screen. You see screen. That's just it. Only those in Olamide's group should sign their attendance, please. And please, Olamide, I think you are taking so much time.
Maybe another group should present. I will try and figure it out.
Okay, then. So I think the next group now can move ahead. I think the next group is Daniel Lawal. That's COF 02. I don't know if you are here.
Good morning.
Good morning. I'll make you the co-host now.
All right. Can you see my screen?
Yes, we can see your screen.
All right. Good morning, everyone present here. My name is Daniel Lawal,
Please,
and
those from his group can sign in now, please.
I will be presenting on behalf of my group, SCOPI, on our policy on vaccination.
You can go ahead. You
Yeah,
have
sure.
5 minutes.
Sorry, I hit a problem. All right, so yeah, we'll begin with the problem statement. Now, vaccination is an essential part of primary healthcare, and it has been very instrumental in prevention and eradication of certain diseases. But here in Nigeria, the overall effective coverage of vaccination still gets a very big question mark, considering the fact that we are still faced with a high prevalence of both in infectious and non-infectious diseases. So an in-depth analysis helps us to narrow down this problem to what you see listed here. Now, there's a disparity in the access to immunization services across several social, regional, and economic determinants in the country. But beyond that, the constant underfunding of the health sector actually places an indirect strain on vaccination projects and research. And then we'll speak about vaccine literacy, because we know that there is a general lack of awareness on the importance of vaccination and the risks of not getting vaccinated against some of these diseases. And we can't talk about the problems without mentioning the inadequacy of effective policies and strategies for vaccination that are affecting the sustainability of these vaccination programs and the strategies. And another problem highlighted are equity gaps that are due to differences in ethnicity, gender, and some other socioeconomic factors that are impacting vaccination coverage. Now, we've highlighted the problems with vaccination. So now we have to talk about how our selected stakeholders come into play regarding our policy. And the first is accelerating the nation's health capacity and universal health coverage. Now, this means that when we improve vaccination coverage, we are lowering the rate of these diseases and will be increasing the overall health quality of the country. But it also requires that we create more awareness in order to improve vaccine literacy, because that will ensure that we increase the vaccine acceptance and then decrease the hesitancy rates. And then speaking about research, we believe that our stakeholders, they have a role to play in contributing towards vaccine development, and also a data-driven approach for the development of sustainability measures that will support the initiative of vaccination in Nigeria. And this also ensures that there is effective vaccine coverage and allows for proper accountability to both the internal and the external health and vaccination bodies. And lastly, we'll mention collaboration, because we know that it provides a very robust framework for us to achieve the progress that we are looking for. It will provide increased availability of resources. It will provide support. It will provide basically to give us an increased reach and impact of vaccination strategies and policies. And lastly, we'll talk about how each of our stakeholders can profess solutions, via both individual and collaborative efforts. And then one of the most significant problems with vaccinations is actually awareness and advocacy. And so we'll call on our stakeholders to actually spearhead vaccination campaigns and outreaches, promoting awareness on vaccination and its benefits, and to also establish trust on the safety and importance of these vaccines, as well as dispelling misinformation about vaccines. And then for the second point, research and innovation has actually allowed for continuous developments that have impacted mankind. But we know that there is no end, there's no limit to improvements. And this is where we need research institutions and educational bodies to actually step in as key stakeholders to prioritize the vaccine research efforts and also leverage on novel technologies that will improve our vaccination strategies. And they must also create a positive environment that will encourage students, medical students, to engage in research on vaccination. And NGOs and other related international organizations are not exempt from this. They must also be encouraged to participate by funding and in this research process. And lastly, the government must apply a top-down approach of properly enforced vaccination policies and strategies that are in line with universal health coverage. They must also develop monitoring systems that will allow us to evaluate the progress, to assess gaps and risks, and to also improve on existing strategies that will enable us achieve an effective vaccination coverage. But I think also we must not forget funding, because it's very
Thank you so much, Daniel, for this presentation. It was quite very nice and enlightening. It was a very good presentation. Thank you so much. I don't know why my recording is going off and on, but whatever is happening is streamed live, so and that can be stopped now. So we'll still have the recordings and everything. So I don't know. And for your own, I think it's quite good and nice. The only thing I noticed was it should be kind of the diplomatic way, the presentation. You should be careful of some of the words you use, like saying must do some stuff and all those kind of stuff. It's not quite nice. I think everything is quite good. Then I think there are other comments from other Yeshua and Rekia. And also I noticed something. You were telling us that it's two groups that are presenting. I don't understand that, please.
okay. So the coordinator for the SCOF team is aware of this, because before we started working on the policy, that was before you said that each group should work individually. We had already started work, and then when the information got to us, we spoke to him about it, and then said that we should carry on.
Oh, the group that wrote on vaccination, 42 pages. Is it how many pages? But you see, that's a group.
Yeah.
Yes.
Okay, that's something totally different. Yeah. I think he's trying to use the document for something. So maybe that was the reason. But it's not quite that way. We'll still look at how we are going to fix those issues in those groups. It's actually not supposed to be that way. So I don't know if there are comments from Rakia and Yeshua.
No comments from my end other than to appreciate the presenter. It was a really good presentation.
Okay, thank you so much. And RK, I don't know if you have any comments, please. You can go. I don't think RK has any comments. So the next group is Olatubosun Olainka, Scope 04. Please, if you are here, you can indicate. Oh, Olamide Sultan, sorry. And Olamide Sultan, can you share your screen now?
Okay, may I say something before we go on?
Yeah, you can go ahead.
Okay, is it possible to be stating who is next after the person you've called, so that we'll understand arrangement and have things in order before, because it's like a surprise, you're just called and then maybe there are things you want to prepare for, a bit like that.
Okay, I think I'll do that. Thank you for that observation.
All right, thank you, sir.
You're welcome. And Olamide, can you share your screen now, please? I can't.
I've shared my screen. You've not seen it?
I'm not seeing your screen.
Okay. Come.
Okay, it's working now. Yeah, I can see it now.
Okay. So I'm Olamide Sultan. Good morning, everyone. I'm Olamide Sultan from School Group 3. I'll be presenting on neglected tropical diseases in Nigeria. Neglected tropical diseases are a diverse group of 20 conditions that are mainly prevalent in tropical areas. In Nigeria, it accounts for about 25% of the burden of NTDs in Africa. People living with NTDs often face stigma, discrimination, largely due to lack of awareness about it, which is one thing that is occurring in Nigeria here and there every time. But there's plenty of hope because NTDs can be effectively controlled, eliminated, or eradicated through combined public health measures, effective treatment, and great community awareness. Now, the impact of NTDs in Nigeria. NTDs have a serious impact on individuals, families, communities, and economy of the nation's economy. For individuals, they cause serious short-term, long-term harm to the health and well-being of those affected. Nigerians living with NTDs also often face stigma, isolating them from their communities and impacting their chances to access education, employment, community services, family. And this traps these individuals in a cycle of poverty. And this cycle of poverty is just all about wasting money on unnecessary traditional apps, which are not regarded in the treatment of these NTDs. But NTDs also enhance their existing inequities to like gender, ethnicity, disability, and as a result, NTDs are most prevalent among this population, least able to access essential services, including women, children, ethnic minorities, and displaced people. Now, stakeholders intervention. There is a quiet need for our stakeholders to intervene in the control and prevention of NTDs due to the following: to improve the standard of living. The intervention of the key stakeholders will help to increase the standard of living of the right people in the society. Like as a nation, Nigeria, when we look at the most areas that are invaded with NTDs, the tropical diseases, the neglected tropical diseases, we can observe that there are majorly areas with low sanitation, poor sanitation, poor hygiene, lack of basic amenities, no water. No, so these areas, when the intervention of the stakeholders, they have to increase the standard of living of these people, because through those practices of control and prevention, they'll be able to live a new life, to be able to boost the economy of affected nations. Now, even if Nigeria is putting about 4.3 billion naira in the health budget of Nigeria, yes, still, they will not be able to even check into NTDs very well, because if they are not intervening in it very well, it will just be increasing and they'll just be putting a lot of funds which are not meant to be. So if they are able to intervene, they'll be able to correct that area. Now, empowerment has always been a problem the nation needs in area of NTDs, and they'll also be able to achieve their dreams of giving back to society and also their society development. The ability to be able to achieve the 2030 roadmap is something that should be important now for NTDs control. Now, this is a chart showing the NTD we are having in Nigeria with the ranking in Africa. We're able to observe that most diseases, Nigeria is in number one, which is one of the problems we should be able to intervene to it currently. Now, what can our able stakeholders do? From the federal government side, they should be able to develop NTD-related policies and strict monitoring for implementation at grassroots levels, and also with periodic review and amendment of policies and system setup to ensure monitoring, management, and eradication. Now, another important aspect is partnership with the private sector, because they are also affected in one area or the other, for financial relief and local NGOs to bring about community-based change. And also, health professionals should undertake and participate in research of NTDs in order to uncover new sites into their prevention and treatment. Another important thing is sensitization of communities in rural and poor regions by organizing outreaches so as to educate people on NTDs, their symptoms, treatment, and prevention measures, and provisions of basic amenities that can help in proper hygiene and environmental sanitation. While NTDs continue to cause great deal of suffering to these world's most vulnerable people, valuable lessons have been learned about what can be done to improve the situation. Through increase in research, funding, and political importance of NTDs, we can hope to overcome one of the greatest global health challenges that faces our world today. The gravity of giving NTDs the time, money, and awareness they deserve cannot be stressed enough, as this is an issue that affects at least 1 in 6 of the world's population. Thank you.
Thank you so much for this presentation. It was very, very good. Like, it was a very nice presentation. And I don't know if you have comments from either Arakia or Yeshua on this.
Well done, Olamide.
Can you guys hear me?
Finally, we can hear you, RK.
Oh, okay. Okay, that was a great presentation. Really, very, very good. I just noticed something about most of the presentations. Your slides. Next time, when you're having a very short presentation like this, bullet points are like most advisable. Then you can have maybe a different document in your own view, where you can be getting most of the explanations from. But the one you share to the audience should be really short. But overall, it's a very nice presentation. Well done to you and your group.
Okay, thank you so much, RK. So, and thank you, Yeshua, for sending the order. So, I think scope all four have presented, right? So, I think it's scope 1 and 2. I don't know how it's 1 and 2. Okay, Daniel Lawal has presented. So, the next one is scope 05. Semimo Emmanuel Waziri.
Scope 04 as presented in person of occasion.
Yes, I'm around. Good morning.
So, yes, so it's a memo Emmanuel Waziri. That's scope 05.
Yes, I'm here.
Okay, good then.
Can I share my screen now?
Yes, you can share your screen.
All right. I still can't share.
You can. Oh, sorry. I'm coming. Let me make you the co-host. Let me make you the co-host. Sorry.
All right, sir. Thank you. This place might sound a little noisy though. I'm in a conference now and cars are passing. I just stepped out a bit.
Now just get the place to stay. It won't affect it much.
All right, sure. But I hope there's no much noise at the moment now.
There's not much noise. You can go ahead.
All right, let me start sharing. I don't know. Can you see my screen?
Yes, we can see your screen.
All right. Okay, good morning, NiMSA. My name is Esimemo Emmanuel Waziri from School 5, and I'll be making my presentation on HIV and AIDS. So to run you through my outline, I have introduction to HIV and AIDS, so I can tell you briefly what it is, and then the problem with HIV and AIDS. And my stakeholder of choice is the government, because I can't input all my stakeholders here. So my stakeholder of choice is the government, and then why the government would want to consider solving this and how to fix it, and then I'm done. So briefly on the introduction, HIV and AIDS stands for human immunodeficiency virus. And we know that this virus destroys the human immune system. It does this by attacking and killing certain lymphocyte cells called the CD4 plus T cells. I would have loved to go more detailed on that, but I don't have a lot of time. So without proper treatment, this destruction of the CD plus T cells can lead to AIDS. And AIDS is acquired immunodeficiency syndrome. So at the moment though, there's no cure for HIV. So the public health sector focuses its effort on its primary prevention and harm reduction. The harm reduction is done through antiretroviral therapy. Okay, so now let's go in and see what the problem is. So HIV and AIDS has been a health issue in Nigeria since it was first diagnosed in Lagos in 1986. In fact, not part of this PowerPoint slide, it will interest you to know that 9% of people that had HIV lived in Nigeria in 2014. So the problem with this disease is not just that it can be fatal if not treated, but also the stigma and difficulty of treatment that comes attached with it. So those are the problems. And then why should the government be interested in this? As a government of this great country, Nigeria, it is your duty to be responsible for the well-being of your citizens. A fatal disease that has been around for decades, such as HIV and AIDS, has been a threat to not just Nigerian citizens, but the world at large. That is why the whole nations of the world are making regular attempts for its complete eradication. One of these attempts is through the UNAIDS 1990 HIV strategy. And more on this detail is on my policy document that I've submitted already. So, and finally, how to fix it. So therefore, NiMSA calls on the Nigerian government to, one, make more antiretroviral treatment facilities to increase ease of access to to people living with HIV and AIDS, as PL-HIV. Okay, because one of the problems, as I've stated in my policy document, is that some of the people don't have easy access to the antiretroviral therapy centers. So it's not really easy for them. And then second, make laws against discrimination and stigmatization at work and healthcare systems. This one is very, very, very important, especially so that this would help them in their mental state. I mean, it's already difficult having HIV and AIDS. And then to deal with stigmatization at work is another problem, okay? So 3, fund and provide resources for research and development of national strategies for the elimination of HIV and AIDS. I think this is self-explanatory. And then finally, implement evidence-based prevention strategies. Thank you very much. I'm done with the presentation for now.
Thank you so much for this presentation. I would like to take comments from Rakia and Yeshua.
Thank you very much.
Okay, for me it was a great presentation. That's good. The only point I have to make is you at one point you were referring back to your policy documents. That's not really advisable when making a presentation. You don't refer back to like another document, even though you think other people must have read it or something. Just come with your facts and whatever and give whatever explanation you can give there and then, and avoid referring back to documents.
Thank you so much. Yeshua, I thought you were...
Yes, so sorry, I didn't realize Raki had started talking. So yes, I'll reiterate what Raki has said. You kept saying that, as you said in your document, the main purpose of your presentation is to come and give a summary of what your policy document is about. So if, like, for example, you mentioned 1990 strategy, there's no big issue about 1990 strategy says that 90% of HIV people should have been diagnosed, 90 of them should be on ART, and 90 of them should also be able to achieve immunologic suppression. So it's just giving a brief summary of what your policy document is about. And I feel that you could still have had enough time to explore your other stakeholders. I saw that you only focused on government. There are also non-governmental organizations that that I feel are also good stakeholders, really. But well done.
Yeah, thank you so much, Joshua, for the comments. I think they have said everything that I'm supposed to say. So I think it's Cora O2, right? That's supposed to go now. I think so. Cora O2, please.
Good morning, everyone. Can I be heard? Good morning, everyone. Can I be heard?
Yes, you can be heard. Sorry, I was trying to make you the co-host. That's why I couldn't speak. Yes, I can hear you.
Okay, I'm trying to share my screen. Okay. Okay. Please just give me a minute. Okay, is the slide showing? Please, can you confirm for me?
Yeah, we can see the slides.
Okay. Thank you very much. Good morning, everyone. My name is Onokiran Bakeji, and I'll be taking the presentation for harmful traditional practices for SCORA O2 group. Now, by way of introduction, harmful traditional practices are defined by the Office of the High Commissioner of Human Rights as particular forms of violence against women and girls, which are defended on the basis of tradition, culture, religion, or superstition by some community members. Now, these problems include, but not limited to, female genital mutilation, virginity testing, child and forced marriage, tribal markings, and scarification. Now, harmful traditional practices have plagued the global and Nigeria society for centuries, and victims are mostly women and the girl child. Now, these practices carry negative health implications and are a violation of her rights to body autonomy, human rights, especially sexual and reproductive health and rights. Now, according to UNICEF 2021, about 650 million girls and women alive were forced into childhood marriages, and at least 200 million girls and women were damaged by female genital mutilation, with 44 million of these girls under the age of 15. Now, in Nigeria, a whopping 19 million of girls and women in the reproductive age group are female genital mutilation victims. Now, why should stakeholders intervene? There are a myriad of effects on physical and mental health, such as psychological disorders, high death rate, poor self-esteem, high rate of suicide and suicidal ideation, society destruction, delinquencies. Also, there is the economic effect on decreased standard of living, political apathy. There is also expenses as a result of legal tussles between perpetrators and victims. Now, how can stakeholders fix the problem or help in fixing these problems? Make laws and review laws to ensure all criteria of harmful traditional practices are fully criminalized and punished. Openly condemn all forms of violence against women and children, in particular girls, and commit themselves to confronting and eliminating such violence. Expand and improve health services and introduce training programs for traditional birth attendants to upgrade their positive traditional skills, as well as give them new skills on a priority basis. Also, the healthcare sector should and practitioners should dissociate themselves completely from any forms of traditional harmful traditional practices. Also, the medical association, the NiMSA medical student, can use their influence to be able to organize outreaches and advocacy to be able to advocate for harmful traditional practices. By way of conclusion, although more attention has been brought to the problems that harmful traditional practices pose to our society in recent times, they are yet to be completely abolished. Hence, they still pose a significant risk to the well-being of Nigerians, especially women and girl child. Now, without actionable policies and programs, the figures that we have seen, like the whooping 19 million of women, would only just rise and spiral. Thank you so very much.
Thank you so much for this presentation. You actually went with the time. There was something I noticed that I want to comment before other people comment. Thank you for showing us the ways NiMSA can intervene in this policy. I think nobody discussed about this since we started. So I think this is a very good point to make. So why are you your presentation? Also tell us, because we are the people here, also tell us how we can intervene and fix these problems also. So thank you so much for that. I would like to take comments from Yusha and Arki also. Please, let's be fast.
Okay, for me, it was an amazing presentation. Well done to you and your group. The only thing is that you were reading the slides verbatim, like you were just reading out the slides for us. And for most presentations, that's not how it should be. Even though that's why they always advise that your slides should just be few bullet points that will help you remember what you're actually supposed to say. Or if you want to have something you can read out, it shouldn't be to our own view. That's the only correction I have. But it was an amazing presentation. Well done.
Yeah, sure. Do you have anything to say? Okay, then I think we can move to the next group. I think the next group is Cora 07. Cora 07, please, are you ready?
Yes, good morning. I'll be presenting for Scora 07.
Okay, thank you. So those in Cora 07 can sign in now. I've made you the co-host, Omar.
All right, thank you. I don't know if you can see my screen.
We can't see your screen yet.
All right, sorry. Can you see my screen now?
Yeah, we can see it.
All right, thank you. So, good morning. My name is Abdurrahman Omar, and I'll be presenting on behalf of Scora 07, and our topic is ensuring access to safe abortion. So, this is the outline I'll be using. So, first of all, we'll be looking at the introduction and the problems of unsafe abortion. So, before we start, what is unsafe abortions? So, WHO defines unsafe abortion as any procedure for terminating an unintended pregnancy carried out either by persons lacking the necessary skills or in an environment that do not conform to minimal medical standards or both of these. So, what are the problems or consequences of unsafe abortions? Generally, we divide it into two. We have the health consequences and the economical consequences. So, health consequences, we have physical and mental complications. So, physical complications, we could have incomplete abortion, profuse bleeding, sepsis, damage to abdominal, pelvic organs, etc. Then, due to the psychological trauma that may be suffered by these women, maybe during the process of the abortion or due to the complications, they can have mental complications like depression and among others. Then, economically, the management of the complications of unsafe abortion takes up to 50% of the health budgets for O&G departments in most hospitals in low-income countries like Nigeria. Then a study conducted in 2002 also revealed that about 1,400 billion naira, which is about 1.4 billion, was used in treating the complications of unsafe abortion, which will have otherwise been used for other economic activities. Then, due to the complications, there's also the economy also suffers a decreased manpower with the associated morbidity and mortality associated with unsafe abortion. So, why should we be bothered about unsafe abortions? Number one is the fact of reducing maternal mortality. Nigeria is one of the highest, has one of the highest rate of maternal mortality in the world. I think about 925 per 100,000 beds, and unsafe abortion contributes about 30 to 40% of these statistics. So reducing unsafe abortion would go a long way towards reducing maternal mortality in Nigeria. And the former president of IPFF once said, no country sends a soldier to war to protect their country without seeing to it that they will return safely. And yet, mankind for centuries has been sending women to battle to renew human resources without protecting them. So why send our women, why let them go through the process of giving birth to new life without protecting them adequately when they don't want to? Then, furthermore, we want to relieve the burden on health resources. Then promotion of ensuring access to safe abortion will also ensure promotion of fundamental human rights and universal health coverage, since one of them is right to health, and there's no health without a comprehensive and total right to sexual and reproductive health, which include family planning and abortion and thereabouts. Then promotion of gender equity. When you restrict choices of women or any group in general to any of their choices, you are basically discriminating against them, which in a way is we promote gender inequity. So what are the proposed solutions and to our relevant stakeholders? So the roadblocks first to safe abortion. In Nigeria, the major roadblocks we identified were the legislation, the societal stigma, the poor health facility and inadequate skilled abortion caregivers, poverty, and unemployment. So we are proposing a holistic approach from all relevant stakeholders, so that the government, the health workers, the medical schools, medical students, human rights organizations, and NGO. We want the government particularly to review the issue of its legislation, both the criminal and penal codes, amend them and enforce new laws that will legalize safe abortion, as Nigeria has one of the strictest and restrictive laws concerning abortion in the world. And not only that, they should provide resources, both health and financial, to create a safe and respectful environment for safe abortion, among others. Then for the health workers, one of the duties of health workers is advocacy for their patients. So we want them to help advocate for safe abortion. And not only that, they should ensure there is provision of referral and to safe and accessible services provider, even when a healthcare worker cannot provide abortion services, because abortion is quite an issue of controversy in a country like ours due to different ethical, religious, and moral obligations. So even when you can't, please, they should provide safe referral services for people who want to undergo abortion. Then not only that, they should also provide adequate pre and post counseling services. Then for medical schools, we want them to include an evidence-based and comprehensive abortion education into the medical education curriculum, while at the same time provide an unbiased training to all issues concerning sexual and reproductive health. Then for medical students and our MSCs and NiMSA too, we want them to partner with MSCs and NGOs to organize roadwork seminar talks and basically to promote advocacy on these issues, so as to bring light to the issue of unsafe abortion and tackle these problems. So the human rights and NGOs have also more of their work is on awareness and advocacy. So in conclusion, having shown the problems of unsafe abortion and how to tackle it, we ask that all relevant stakeholders, which we mentioned, should all band together to give everyone access to.
Thank you so much for this presentation. It was quite very, very good. Like, it was very nice for me. I don't know if we have other comments from others. And RK and Yeshua, any comments?
Thank you very much, Omar. I appreciate that you kept the time, and I feel that this is like a good example of how the slide should be. Just short bullet points, and then you get to elaborate on it. Well done.
Okay, thank you so much for that comment. I think someone raised their hands. I don't know, the person later dropped it. So I think we are moving to the next group. The next group is Cora O3. I don't know if they're here.
Yes, we are here. Good morning.
Morning.
Can you please make Khair Arama co-host? She's the one that's going to display our presentation.
Okay, I thought you were the one. Sorry. On Arama, you can share your screen. Okay, you can start now. All of your group members should please sign in. You have 5 minutes.
Good morning, everyone. Can I start?
Yes, you can start.
Good morning, everyone. I'm Aminat Bello. I am my.
Oh, sorry. Please, you can go ahead. I thought it was the other person presenting. Please, you can go ahead, please. Aminat Bello, you can go ahead, please. I thought it was Asmau that was presenting, or Umnul. I didn't know that it's three people that.
Yes, two of us are present. Going to take the first part.
Okay, please, you can start now. We can't hear you, please. Please, we
Hello,
can't hear.
Can you hear
Yeah,
me
we
now?
can. Yeah, we can hear you now.
Okay, good morning, everyone. I'm Aminat. Aminat Bilo. I and Asma will be presenting on behalf of Scholar O3 on harmful traditional practices. Harmful traditional practices refers to socially and culturally accepted behaviors and practices that are harmful to people's physical and mental health, especially women and children. And these practices include female genital mutilation, child or early marriage, wankanjego, also known as hot water bath, tribal marks, women as the sole cause of infertility. Then we have widowhood rights. Did you know that Nigeria has the highest absolute number of cases of female genital mutilation in the world, accounting for about 1/4 of the estimated 115 to 130 million circumcised women nationwide? Over to you, Asmau. Asmau. Over to you, Asmau.
Good morning. My name is. Okay. 200 women have been through FGM worldwide, and about 1/4 of them are Nigerians. And about 650 million children living today were married off before the age of 18. So why should stakeholders intervene? Number one, health. These practices adversely affect the health of individuals. It leads to increased rates of maternal mortality and infant mortality, obstetric complications, and eclampsia. It leads to recurrent urinary tract infections, increased rate of sexually transmitted diseases and HIV, and a lot of other things. Socially, it leads to other communities, and this might affect international relations. It also increases the chances of violence against women. Psychologically, it leads to emotional trauma, like from being separated early from the parent and lack of emotional support, and the feeling of isolation. It leads to depression and anxiety, and in some cases, even attempts of suicide. And it is a violation of human rights, including the rights to life, rights to freedom from torture and cruelty, inhuman treatment, and most importantly, it's a violation of the rights of the child. Economically, it risks foreign investment due to bad image, and it might lead to restrictions to trade. So how can we fix this problem? But first, let's talk about the cost of inaction. If we do nothing about harmful traditional practices, female illiteracy rates will continue to rise, and is directly correlated to maternal mortality rates, infant mortality rates, gender-based violence, sexually transmitted diseases, obstetric complications, high poverty rates, etc., etc. So we call upon the government to not just create, but also strictly implement laws to remove the barriers and bottlenecks to law enforcement, to allocate resources for treatment and rehabilitation of victims, to involve communities in awareness campaign and spread the word. It is very important to engage the people in and to start a conversation. We call on the general public, religious leaders and traditional leaders to educate the public on the dangers of these practices, to advocate actively against these practices, to support the victims of these practices, and don't be a bystander. this is to the general public. Do not be a bystander. If you see something, you have to speak up. To the medical students, to NiMSA and to NGOs and civil society organizations, we call upon them to organize awareness campaigns and rallies to educate the public about the dangers of these practices. To medical students, schools, and secondary and tertiary institutions, especially secondary schools, we need to include these things in our curriculum. We need to talk about them and explain how they are harmful to the individual, and to hospitals and health service providers. They should provide a safe space and treat the victims of these practices without judgment and with compassion, and to punish those who medicalize for female genital mutilations. Thank you.
Thank you so much for this presentation. Before they take in the comments, I would like to make comments. I like your slides, like it was very fine. So thank you so much. So I would like to take comments from Arakia and from Yeshua.
Thank you.
If you asked me, that would have been the first thing I would have said. Really nice slide, and well done.
RK, do you have anything to say, please? I don't know if she's here. Okay, if she's not, she's here, right? Arakia, please, do you have any comments on this? Okay, I don't know what's wrong. She has not spoken up yet. And for me, I just had a major comment, like a very simple comment. It's based on the process for your presentation. The switch wasn't quite smooth. And also, it was quite fast, like your speech was quite fast. I wouldn't say like the words were coming out so fast. And it might affect someone that, as I stated earlier, someone that doesn't know much about the issue might be affected, but everything was quite good. So thank you so much for this presentation. It was quite good.
Thank you.
So I think we'll move to the next group. The next group is SCOPI O3. So SCOPI O3, please, are you ready?
Yes, I'm present.
Okay, I've made you the co-host. You can share your screen. So if you're in SCOPI O3, you can fill the form now. You can sign in attendance.
All right, I'm trying to share my screen, right? Can you see my screen now?
Just hold on. It's trying to share. Yeah, we can see it now. Your voice is cracking. Yeah, we can see your screen, but we can't see the slide yet.
Just give me a minute.
I think your screen is quite delaying. Please, Cora, Ona, you should get ready after this presentation.
This is for representing
I can't hear you, sir, and your slide is not showing. I think you're having network issues.
Can you hear now?
Yeah, it's more clearer now.
How about this list?
Yeah, I can see your, you can open this slide now.
Sustainable development goals follow agenda on development
Your voice is cracking, please. I think you should just get ready. The next group can just go ahead. When you are ready, then they can, when you fix this issue, then we can just go with you. So I don't know if Scora Ona is here, so that they can just get ready for you.
I'm here.
Okay, then I've made you the co-host. You can, so, and please try and fix your issue. So after her, then you just go ahead.
All right. Okay, then.
You're welcome. You're welcome. So, and Gloria, you can go ahead.
Can you see my screen?
Yes, you can see your screen. So those from Scora 09 can sign in now, please.
Okay, good morning, everyone. I'm Gloria Madu by name, and I'll be presenting on behalf of my group Scora 09. This is the presentation on gender equity policy proposed by Wumi Aman, Gloria Madu, Aishat Adedej, and Chamaka James. And here's the outline I'll be using for my presentation. Okay, so before I proceed with my presentation, I would like to briefly recall a discussion I had with my friend. We're talking about some issues on gender equity, and for some reasons I was really happy about his perspective on the issues, and these were his words, and I quote, he said, "People should be given equal opportunity and the space to exercise their basic human rights, irrespective of their gender, Okay, so this brings me to the problem of gender inequity. Gender inequity, it's an unfair treatment of an individual because of their gender. And most times it's closely related to gender inequalities because gender inequities could bring about gender inequalities. Now, these inequalities can lead to a lot of discriminations and disparities in different systems, in the medical system, in the marketplace. It's just different systems. Now, there's the statistics from the UN Women, which states that as at February 2021, only about 3.6 seats in the parliament were held by women in Nigeria. This is just one issue out of the numerous issues we have on this subject. Okay, so why is this policy important? This policy, it's very important to help guide our members on the updated information on the stance on gender equity and how far it has come in aiding gender equality, and then what can be done to bring about these changes. Also, bringing about this, implementing this policy will also help to change lives, build a better society, and also create awareness on the issues which surround gender equity. Now, stakeholders to implement this policy, we need the government, we need medical schools and different MSCs, we need the international agency and NGOs, we need the health sector, and we need various universities. So now, how can the stakeholders be part of the solution? We need these different stakeholders to help make and implement policies, to check on different inequities and inequalities which occurs in different systems. We also need them to help sensitize our communities on the growing need for gender equality. We also need them not just to make those policies, but also to adopt those policies to enforce gender equality in all settings. We also need them to help in provision of support to the less privileged genders who are marginalized in the society. We also need the stakeholders to ensure equal representation of all genders in leadership and non-leadership positions, just like what I stated in my first slide about one of the issues, using the statistics according to the UN Women. Okay, so why are the stakeholders important? These stakeholders are very, very important because without the stakeholders, this policy cannot be implemented. And because the standards keys to opening doors to solving the issues which these gender inequities cause. And also, they also would help us, to influence different communities and also the society at large to enact the change needed, because it's one thing to bring about the policy and it's another thing to enact the change we need through these policies. Hence, the stakeholders are needed to make this policy a realization. Thank you. Thank you so much. I'm done.
Okay, thank you so much for the presentation. And I'd like to take comments from Rakia and from Yeshua.
Okay, thank you. It was an amazing presentation. I have no correction. The only comment is it was really great. Well done.
Okay, thank you. Then Yeshua, do you have anything to say before we move to the next group? Scorer 08 will be presenting next. I just hope they are okay. Yeshua, I don't have any comments. So Scorer 08, are you ready, please?
Yes. Yes.
Oh,
We're
okay.
ready.
Okay, I'll make you the co-host now.
Can you hear me?
Yes, I can hear you.
Okay, thank you.
You can share your screen.
Okay.
Now.
Okay, yes, I'm about to. Okay. Can you?
Oh, sorry. I think I missed a group.
Yes,
but you can just go
can
ahead.
You say?
Yeah, you can go ahead. Just go ahead. You have 5 minutes.
Sorry, I can't hear you. Can you see my screen?
Yes, I can see your screen. You have 5 minutes, please.
Okay. All right, thank you. Good morning, everybody. My name is Dote Kaju, representing Scorer Subgroup 8 in the policy presentation on gender equity. So by way of introduction, I'll go straight to define what gender is. Gender refers to the culturally and socially constructed roles of men and women in a society. And in Nigeria, the legally recognized genders are male and female. While gender equity is giving fair opportunity to males and females with the aim of giving them an equal outcome. So that's to ensure that there's a level playing field for the both sexes. So why gender equity? Why are we talking about it? Why is it a problem? Gender equity, number one, is connected deeply to the fundamental human rights, and failure to achieve gender equity will mean disregard for fundamental human rights. And then the gender inequity and its effects are very visible in Nigerian society today. We see it in gender-based violence, inequitable access to quality education, healthcare, and economy. One very important example comes up in a research that was carried out that stated that 52% of women of reproductive age cannot independently make decisions regarding sexual intercourse, and also access to reproductive health services. So it's a big problem. And then thirdly, the third Sustainable Development Goal states that to achieve gender equality and empower all women and girls. And the way to achieve this is by ensuring gender equity, because equity leads to equality. And I'd like to give an example. A study done recently showed that between 2000 and 2017, only 10% of women were involved in various national, lower, or single House of Parliament. So of all the people that have been in this capacity as of 2017, only 23.4% of them were women, which is a very, very small number. So it takes us to the next question. Why are we talking to our stakeholders, talking to the government, we're talking to NGOs, we're talking to Nigerian Medical Association and medical schools, the MSAs? Number one, gender equity is present in all spheres of society, but the impact it has on education, economy, health, and governance is where these different stakeholders can play their roles in ensuring that something happens and there's level playing field for all the genders. And then gender inequity ultimately produces a society with serious deficits in the areas mentioned before. And we do not want this, because we want a progressive society. And for any meaningful change to go, we need political will, and that involves the government, and we need all the stakeholders working together to ensure that this is achieved. So the question you ask, what can you do? While the individual stakeholders can work independently, one approach that we think would be very relevant would be collaborative working together. So through regulation, we see how the government can contribute through ensuring that laws against cultural and traditional practices do not ensure gender equity can be tackled, and legislation for compulsory basic education for all genders, because it's very important. And then organizations, so through NGOs, NiMSA, medical associations and all, can work with the government to ensure that there is representation through education. And then with the government, they can also ensure that there's equitable resources, economy, land and natural resources available to ensure that everyone is fairly treated. And then information, so through cooperation with NGOs and international agencies for accountability and feedback. And then there should be regular review of effort put in to check that gender equity is ensured. So combination of all of this will ensure that there's gender equity and to remove the structural and cultural barriers to gender equity in our society. Thank you very much for listening.
Thank you so much. I really like this presentation. It's very, very nice and straight to the point. And how you explained it was very good. So I would like to take comments from Reki and Yeshua.
I don't have any comments. Well done. It was an amazing presentation.
I enjoyed it. Well done.
Thank you very much.
Okay, you're welcome. So Christopher, please, you are supposed to go next. I will make you the co-host now. Can you hear me, Christopher? Christopher, can you hear me?
Yes, I can.
Okay, good. We can see your screen now.
So everyone, and I'm representing SCOPI on the presentation today.
We can't see your slides.
So
We can't see.
I'll be talking.
Okay. We can see it now. You can go ahead. You have 5 minutes. Yeah, but it's cracking, sure.
I'll be presenting presentation goals, follow up of the Millennium Development Goals, and it is supposed to cover a period of now to 2030. The problems associated with sustainable development in Nigeria are poor policy formation and implementation. Okay, it is obviously that in our country is more of a say country and not a do country, which by that I mean, okay, we are more we say what we want to do, but rather than acting on it, and that is just the what is associated with poor policy formation. And then the next indifference of since towards sustainable development goals. Even as the government will try to, I think, to ignorance and other reasons best known to them would show a lot of indifference towards the government's effort. And then inadequate facilities and infrastructures can to carry out tasks and reach out. Okay, for the fact that some individuals would want to make a move on sustainable development, the lack of inadequate facilities, infrastructures, social amenities, and the rest would limit their efforts. And then furthermore, poor communication network. The poor communication network we are having in Nigeria these days can be a limiting factor to sustainable development, and that could be a major drawback to the effort of individuals that would want to push to its highest height. And then lastly, on the problems, lack of funding. Lack of funding is an umbrella to all of this, because if there are appropriate funds to carry out all sustainable development goals, it will even cover the all other problems that I have said earlier. And then you see that lack of funding or funds, to some extent, is a major problem in this drive for sustainable development. Why stakeholders intervene in implementing sustainable development goals? Stakeholders play a major role in the implementations of policies. And then if stakeholders should take on themselves to drive development, it will be a major stride for the whole populace, even if some other people do not take it upon themselves. And with this, it is needful to say that if stakeholders act rightly and timely to the call of action, and the goals will not only be actualized, but they will be sustainable for a long period of time. Okay, fixed length of sustainable development goals in Nigeria. One, the government should develop and implement and sustain goals in every part of the government. If the government follow up with action, their policy making, it will go a long way to sustain goals, development goals in the country. Also, educational system individuals should enlighten citizens. Therefore, organizations like NiMSAs and other MSAs chapters should take it upon themselves to educate citizens on the benefits of reaching sustainable development goals. And then state-of-the-art facilities and infrastructure to be set up in various parts of the country to ease at least the stress and cost of time in actualizing the sustainable development goals. Communication should be a primary and a key thing to look into in this strive for communication channels should be set up, and then a proper chain of communication should also be set up, and good sense of dialogue should be inculcated into people so that these goals won't take as much time to attain. And then lastly, attention and priority should be given by stakeholders to funds. This goes majorly to the government and then to other charity organizations, foundations, and all. Like, attention should be given in doling out money. Money should be given and money should be doled out in good quantity, so that when people are pushing for sustainable development, they will do it to the highest peak of it all. Thank you. I'm done with my presentation.
Thank you so much, Christopher, for the presentation. I would like to take comments from Rekia and Yeshua. No sign out from you, only sign in. That's just all. That was why I say, if you want to stay, you can stay, but it's not compulsory. Scorer 04 should get ready. RK and Yeshua, do you have any comment for this?
Well done, Christopher. Well done. I just want to reiterate that the slide could have been maybe more catchy than putting what you have to say in bullet points, but still well done.
Rakia, any comment? Okay, I think we'll just move to the next group. So please, for those that had issues earlier, please, can you write the name of your group in the chat box again? Because I think this is the last group on the list that we have. Scorer 04, please, I think Bethel.
Yes, I'm ready.
Okay, so I'll make you the co-host now. I don't know why your background, I'm hearing a sound, is it your earpiece that is making that sound? I don't know.
No.
Okay, I've made you the co-host now.
Is it sound okay now?
Yeah, it's okay. I'm still hearing it, Sha.
Can I proceed?
Yeah, it's okay now. You can proceed. You can proceed. Please, those from his group can sign in their attendance now.
Can everybody see my screen?
Yes, we can see your screen.
Okay. Good morning, everybody. I'm Okemezem Betel. I'm presenting for Scorer Group 04. We are talking on the topic menstrual health and ending period poverty. The objective of this presentation is, by the end, we need to understand what menstrual health and period poverty is all about, then need for the policy to be adopted and challenges surrounding its implementation, then the possible ways to tackle this challenge. Moving on the first point, which is menstrual health and period poverty, who needs to know? Most people, when we talk about the menstrual health, many will think that we are talking about the females only, but that's the fact, but not really the truth. The knowledge about menstrual health is to be made known both for the males and the females. And knowing the fact that health is one of the fundamental rights of an individual, so the menstrual health is also included, including everything that will enhance menstrual health. Now, period poverty, when we keep talking about the period poverty, is not really about the inability to afford products. Some individuals don't even have access to hygienic facilities or feel unable to manage their periods with dignity. So this is also a challenge. And the right practices for this hygiene is very, very crucial and paramount because it will reduce infection associated with the reproductive tract. Because if this issue is not treated, infection surrounding the reproductive tract can also result to unpredictable complications. So now, what are the barriers to menstrual health education and hygiene? First is poor information from the media. Most of the information from the media is not really that the information is wrong, but to an extent is outdated because some of the informations are not coming from professionals. So this has been a problem to menstrual health education. And another one on the point is a stigma or taboo and religious belief about menstruation. This is no longer a welcome news that some religions do stigmatize females during their menstrual period. And this makes the ladies to lose their dignity and is really a problem facing menstrual health education and ending period poverty. Another one is some cultural practices, which is also related to the religious taboos we mentioned earlier. These ladies in some cultures during their menstrual period, they are being stigmatized. And now, lack of unlimited access to period products. Some people don't even, from the survey conducted lately, it is shown that most of the ladies don't even have access to purchasing period product like sanitary pads. Some even use clothes and cotton, and some even wash sanitary pad after using it. So it has been a problem facing menstrual health education and hygiene. So now, looking at these problems, what are the possible ways in which this problem can be averted? Now, the first is educating the public on menstrual health is the key solution. Now, this education, just like we mentioned earlier in the problem about information coming from the media, this education needs to come from professionals. So professionals need to educate the masses on issue concerning menstrual health. Now, provision of period products can go a long way in ending this period poverty. So NGOs can fund some campaigns and in these campaigns, they can share sanitary pads. This can help to end period poverty. And adequate infrastructure, both in schools and home. When we mean about adequate infrastructure, we mean about public toilets and bathrooms, because in most schools, these things are not being provided, and it poses a problem to menstrual health, education, and hygiene. So these facilities, including borehole and water, needs to be provided in schools and at homes. And proper sanitation and facilities surrounding the environment. These environments where we have these public toilets, the bathrooms and the bowl, all of them, the place needs to be kept clean in order to help to maintain a high hygiene during this period of menstruation. So in summary of everything, I want to end by saying that we need to end period poverty to achieve sustainable development goals. So at this, I come to an end of the presentation.
Wow, thank you very much. This is very, very good. Thank you very much for this presentation. So I would like to take comments from Yeshua and I don't know if RK is here. From Yeshua and RK. Yeshua and RK, please comment.
Oh, okay. I was trying to speak. Can you hear me?
Yes, we can hear you.
Okay. Well done to the group. It was a great presentation, honestly. I don't have any corrections for you guys. Hold on.
Okay, thank you. Yeshua, do you have anything? Before we move to the next person is Sunday Priska that is supposed to present. Okay, no comments, right, Yeshua? Okay, let's move to Sunday Priska. Please, can you hear me?
Yes, I can hear you.
Okay, I've made you the co-host now. Please, all those people that are supposed to present that have not, please just type in your group name and the person presenting in the chat box.
Can you see my screen now?
Yes, we can see your screen.
Okay. Good morning, everyone. I'm Sunday Priska, presenting on behalf of SCOPI 04 on the Sustainable Development Goals. So the Sustainable Development Goals were actualized in 2015 following the expiration of the Millennium Development Goals, and they are a blueprint to achieve better future for all. That's for the universe. So coming down to Nigeria, application of the Sustainable Development Goals in Nigeria, there have been progresses so far, challenges, and even plans to achieve these goals. So the progress is here. We have establishment of frameworks. These frameworks like civil society organizations, and we have grant schemes given to sub-national governments to help them mobilize resources to accelerate the progress of the SDG core areas. And then they have been able to identify vulnerable groups via establishment of public or national social registers. Then we have the key challenges towards the achievement of the SDGs. One, we have the infrastructural deficits and technological gaps which hinder service provision and application of science and technology innovations. And this has posed a challenge on SDGs like education and health. We also have economic recession in the country, and obviously it's a very, very great challenge towards achievement of the SDGs. We also have humanitarian crises like herdsmen to farmers crisis, and even Niger Delta militants, which have posed a threat to SDGs related to safety and can affect other SDGs like hunger and poverty. So what are the plans set up to achieve these goals? Nigeria's national development framework being integrated. We have SDG dimensions, integrating the SDG dimensions into national policies and plans, partnership and collaborations, and technological transfer and capacity building. Now, the stakeholders, why are these the stakeholders and why should they intervene? The Nigerian government is just like the first line of action to SDG achievement because they oversee the affairs of the nation. So it's expected that they get involved in the achievement of the SDGs through various arms of the government and ministries like Ministry of Health. We have the youth, which contribute to the largest quota of population in the country. Contributions like manpower, individual advocacy, and even interest in policy making of SDG will go a long way. We have NiMSA and NiMSA standing committees, especially SCOPI, which is actually at the forefront of all standing committees in achievement of these SDGs, because they can create massive awareness, particular to health of citizens, which is even the ultimate target because health is linked to all other SDGs. We also have the civil societies, because the civil society links government and the people. So they are a vital voice for human rights and they monitor government policies and actions. So they can identify SDGs as important priorities and set up policies and programs for the SDGs. Now, fixing the problem. The government can fix the problems by incorporating SDGs into national policies and also national budgets. We have the NiMSA standing committees and MSAs organizing outreaches, massive awareness programs, online awareness programs, and the rest. To have youth should actually develop interest in and active participation in achieving the SDGs. Medical institutions should find a way to input SDGs into the curriculum, and also during community medicine postings and others, find a way to incorporate SDGs into medical research projects. The civil societies like NGOs and others should should find a way to contribute resources and partner with government so as to actually realize or actualize the SDGs in the country, and also motion for continuous advocacies in the country. So that's it for the SDGs. Thank you.
Thank you so much for this presentation. It was quite nice. I would like to take comments from Rakia.
Thank you for the presentation. It was great. I don't have any comments, any further comments at this point.
Okay then. Okay then. So I think, does any group that is supposed to present this morning that has not presented? I think Yeshua, you stated some names in the group. I don't know.
SCORA 1, SCORA 3, and I think SCOPI 5, SCOPI 2. So SCORA 1, SCORA 5, and SCOPI 2. Those are the groups that haven't presented yet. And I don't think they're in this meeting because I've been asking.
SCORA 04, I think they presented. I think they presented. I think so. They just presented just now.
I said SCORA 05. 05.
Okay.
Yes.
So I don't know if their members are here.
01 and SCOPI 02.
If they are not here, then we'll just end the meeting. We are all busy. I have something that I'm supposed to do now, and I've not even started. So I think we'll just end it if they are not here. Those in the afternoon can just go ahead. And after this, who is unable to sign in? Sunday Priska, why are you not able to sign in, please? I've taken note of your name, but please keep on trying and sign in also. Try and sign in again. Just try it. The link is not opening. I think it's your network. If not, we have not closed the form yet. We'll be closing it after this. It's most likely be your network that is the problem. So, and thank you everyone for coming for today's session. Sorry for the presentation, and it was quite amazing. All of the presentations were very encouraging, and it was very, very good. So thank you everyone. So, and also I'd like to make a point. We are going to, the last thing you are going to do is just your assessment. That will be next week Saturday. So just open for, I think, 2 hours, just 20 questions that you answer. The time frame will be 2 hours. So between those periods, you're supposed to sign in and just do, it's just 20 questions. I can just finish it in less than 30 minutes. So that will just be the assessment. After that, like, you have concluded with us, you have done everything, like you have finished everything. So that's just it. So I just, all of you should try and prepare for it. Just 20 questions, and that will be the last thing that we'll do. So if you have any questions, you can ask now before we close. Oh, Sunday Priska, if you signed in previously. Wow. Okay, then I'll take note of your name. I'll fix that issue. So please, if you have any question, please, you can ask now, please. Okay, I feel there's no any question. Then if there are any comments, you can please add now. Okay.
Sorry, I want to say something. One of my group members actually, she has been present in the meeting, but I think network became a bridge when I was presenting. But I don't know if she signed in previously, like when we were first called. But she has been in the meeting with me, the one that wanted to share the screen previously.
Okay, what's the name, please? Just type it in the chat box. Let me see.
Okay.
Okay, then it's Yusuf. So please, you have any comments? You can just make your comment now before we move on. And also, I'd like to add, maybe you have any comments concerning the presentations. Did you enjoy the presentation? Like, as you presented, do you enjoy it? Do you feel any anything? Please, you can make any comments now. I just want to give, if 2 minutes, somebody can say something before we go on. We'll still get if something for feedbacks, but I would like to want to hear something now, like, so that maybe if there's anything we can improve in the next session also. There's some people were tense. Sorry for that. Nobody wants to talk, but everyone can present, but nobody wants to talk. I think that's all for now. Thank you everyone for coming. I think we'll be ending the presentation session for now till in the afternoon by 2 p.m. when the next sets will come in. So thank you everyone. You can still join in please by 2 p.m. to listen to how their own will also be. So thank you everyone for coming. Goodbye.